All righty, we're live. So, Dr. Kris, welcome back. How are you?
I'm good. Happy New Year, Steve.
Happy New Year. So, peptides and age management with Dr. Kris Wusterhausen of the Resurge Clinic. And we're starting off this year with some excellent conversations. I've been enjoying the ones we have. I was talking with my aunt, by the way, Dr. Kris, and she's pays attention to these. So she's been doing a little bit of intermittent fasting, a little bit of Alka-Seltzer Gold, even a little ketone esters as well. So people are benefiting from that. By the way, just want to say that these conversations are intended as educational, and please always consult your physician before changing your medical program. But today's topic is one that I think is on a lot of people's minds. There are vaccines now available. Usually there's vaccines around this time for flu, etc. There's more vaccines in development. So I'm sure there's a lot of questions surrounding those. So where should we start, Dr. Kris?
Well, I think we should just maybe, especially with what happened yesterday and just our whole general, feel of the last year has been so negative. I think that there are some positives if we try to really look at it. And all I'm really asking my patients and friends with the new vaccine is just to be open-minded towards it. Ultimately, obviously, at the end of the day, it's your choice whether or not to get the vaccine, at least at the moment. And I'd like to talk about that in a little bit because I do think it's for the moment. And I understand people's hesitations. I was one of those, even as a physician, that really hesitated until I was able to truly look at the data, the technology, and ultimately I became comfortable with it. I was lucky enough to receive the vaccine on Monday. My nurse practitioner, Karen, and myself both got our vaccines Monday. We did get the Pfizer vaccine. It just happens to be the one that we had available. And so it'll be repeated in 21 days. You have a plus or minus, I think it's 4 days to get that second one. I can tell my patients out there and friends out there, I had a sore arm for about 18 hours. And after that, I've been perfectly fine. Same way with Karen. I've talked to at least 10 patients today that had the vaccine on Monday along with us, and everybody has kind of had the same experience. But going back to all the negativity, because the one thing I haven't understood on social media is there's a lot of, in my opinion, a lot of people who are trying to make others feel bad for getting the vaccine. And I just simply don't understand that reasoning. If you're educated, you decide to get this vaccine, I think that's great. It's an amazing accomplishment that this vaccine in less than a year went from concept to on the market. Now, I know some are going to say, well, isn't that too quickly? Well, we're in a pandemic. The rules are a little different today. And it just required these studies to have different phases going at once versus going from phase 1 to phase 2, phase 3. They had a lot of these phases going concurrently. And they were able to, they didn't test as many patients as they normally would, but they were able to test a few, like 30,000 patients and show the safety of this vaccine. There's another type of vaccine that another mechanism of a vaccine that's coming out most likely soon from AstraZeneca, which we can talk about. But anyway, ultimately, after I did my research, I became very comfortable with it. I just wish that more people had access to it at the moment.
Well, so let's do the basics. Vaccines. The premise of a vaccine is that they kill whatever it is and put it in you, and then you develop antibodies, natural resistance to that particular strain, flu strain, so that if you're exposed to it later on, that your body's already prepared to fight it, correct?
Correct. What makes this vaccine a little bit different, it is definitely the first of its kind. It's a messenger RNA vaccine. And the first, thing I want to dispel is it is not a DNA vaccine. I hear that a lot, that this vaccine could alter your DNA. No, it cannot. It is a messenger RNA vaccine. It has nothing to do with DNA. I think too many times people get RNA, DNA confused. Basically, what they've done is
what's the difference between just RNA and DNA for me?
Well, DNA is our genetic material. It's what holds our genetic code, whereas RNA is what basically the DNA messages the RNA to make proteins that we need for different functions in the body. And so RNA is very different than DNA. And so there are DNA vaccines in the works. This is not a DNA vaccine, at least not what we have out currently. And so basically, the easiest way I can explain this vaccine is that all of the SARS-CoV-2 and we even think the new strain that's out in Europe and South Africa have this what's called M spike. That is what basically we're being immunized against, the M spike protein. And so they have basically created this mRNA synthetically that they inject into you that then triggers a mild immune response to this M spike, so that, and creates antibodies, so that versus some vaccines where you just get dead copies of the virus injected into, like a flu shot. And so you get this M spike protein, this messenger RNA, it triggers antibody response so that when you do come in contact with the true M spike from the live virus, that the body will react and has a 95% chance of basically keeping you from becoming infected. And even in that 5%, what's believed is that if you are one of those patients that, despite the 95% protection, get corona, COVID-19, that the infection itself will be a much lesser case. And so that's kind of in theory what's happening. The one that's coming, most likely, it looks like it's going to be approved. It's been approved in Africa already, is the AstraZeneca version, which they are basically using it's kind of a novel concept. They're using a Trojan horse type virus. They're actually attaching it to the adenovirus, which is the common cold. And you take it into the body and it has the messenger RNA attached to that. And that's how they're basically putting it into the body. But in theory, the two vaccines that we have currently, Pfizer and Moderna, are quite similar enough that I think you don't really have to differentiate between the two. Really, the only difference is in transport and administration. The Pfizer vaccine must be kept extremely cold. It's freeze-dried, whereas the Moderna can be kept in a normal freezer. The Moderna vaccine can then be, after it's been defrosted, can be kept in a refrigerator for up to a month, where I think Pfizer can be for like 10 days. And they both must be administered within just a few hours after they've come to room temperature. So I think you're going to see Moderna in more rural areas kind of ruling the show, just because it's hard to keep vaccines at minus 70 degrees Celsius out in your rural areas if they don't have those type of deep freezers.
So I have a question for you. If you have to go get tested to see if you have it, and in some cases, some people have been exposed to it, have it, but they didn't have any effects to the point that they needed to be tested to know if they have it. If you tested positive, then would you need to be vaccinated?
Yeah, I think that's probably one of the more common dilemmas that people face. And my answer is yes. The reason being is that about 10% of patients lose their antibodies quite rapidly, like within just a few weeks. And that's a fairly significant number. We do say now, if you remember right when COVID came out, we said if you get it once, you never get it again. That was the first thing. Then it went to about, well, you get immunity for 60 to 90 days. I think most experts now are saying that we believe you get immunity for 3 to 6 months for the average person. And so it's certainly not lifelong immunity. The problem is, here's another question I get asked all the time. Well, okay, how do I know when my immunity wears off? You don't, unless you repeatedly do antibody testing. I have no way of knowing. And even when we do antibody testing, if you have IgG antibodies today, that doesn't mean you have them tomorrow. So the test is only good for this one point in time. And so how do you know when you lose your antibodies? Versus, how about I just get immunized? Now, one of the other negatives that we probably should get to is how long would this immunization last? we don't know the answer to that question. I believe, I suspect that this will become an annual based vaccine, just like your flu will. This is a mild immune response that you're initiating with a messenger RNA. It is an immune response that will most likely, that immunity will fade with time. I've heard some people, God forbid if this is right, say it may only last 6 months. I just don't think we know. I'm hoping it certainly lasts longer than that, like 12 to 18 months. But that's where these companies are going to simply have to keep testing the test subjects and seeing how long their immunity lasts on average.
It's interesting. I heard something, and I may be wrong, but there's like up to 60 other vaccines in stages of development or testing or whatever. Why do we need so many?
Well, I think what's happening is we're actually, this messenger RNA and is really kind of unlocking a lot of different abilities to immunize against different diseases. You know, it may not be a disease that causes a pandemic, but if there's a way to prevent different viruses, different diseases, why not do that if we have that ability? I think just because there's 60 doesn't mean all 60 will obviously reach market. There's probably a lot of duplicity there. There's probably a lot of different, just look at COVID. Who knows how many companies are going to end up with a COVID vaccine? We need that, to be honest with you, because we simply can't rely on a couple of companies to produce enough COVID vaccines to vaccinate the world. That's just not reasonable. So you need multiple manufacturers for this vaccine. But, you know, I think that we're on the verge of a plethora of vaccines against different diseases, and it'll be an amazing thing when it happens.
Well, so another thing that's kind of confusing for me is now they're talking about a mutated strain or some version, and I've always understood that flu shots were based on a prediction of what the vogue strain of the year is going to be that winter, right? And so what's the situation here? Do we have to hurry and develop another vaccine for this dreaded mutation that's happening now?
So let's hope not. In theory, my answer to that is no, we will not. I do think statements that we're for sure this vaccine will cover the mutated version, I think, is a little bit strong in my opinion. I don't like definitive statements like that. But the reason we believe that these two vaccines are going to work against the mutated, much more contagious strain that has been already detected in a few states in the United States is because of the M spike protein is still on that virus. And that's ultimately what the vaccine is giving antibodies towards, is that M spike protein. And since the new super spreader strain, as they call it, I've heard it called that, since that still has the M spike, you should, in theory, still have immunity towards that. I think everybody's really cautious. The last thing you want to do is give out to the public that, oh, we don't know if this covers that new strain, because I think that, everything would come unravel at that point. But I feel we need to be immunized against what we have right now, no matter what. I do think it's going to ultimately show that it's effective against the new version as well. Now that's compared to the influenza virus, which has got multiple different strains. They look in the Far East, and they predict what strains are going to come all the way across over to us, the United States, many months later. That's basically a dead viral vaccine. They're giving you small doses of that strain, but dead, and creating an antibody response that way. So it's a totally different type vaccine, and that's why, because there's so many different versions of the influenza virus, and they're really quite different. Whereas at least up to this moment with COVID, they have the M spike protein on their cell membrane.
So if the survival rate right now is what, 99.9%, assuming you get it and you don't have severe comorbidities, you're more than likely will survive this. Why wouldn't someone go, I think that since I'm young or since I'm in a good health state, why wouldn't I be more open to, if I get it, then I will hopefully take one of the treatments that exist that seem to be effective? Why wouldn't I think that way?
I think the first and easiest answer I would say about getting it is being a good human. That would be my first thing. And the reason I say that is because it would be one thing if we get SARS-CoV-2 and we simply infect ourselves and that's it. We
Mhm.
know that most people will infect a few hundred patients just from one single person, because you give it to a couple of people before you know you have it. There's actually an anonymous study that was done a few months ago. 66% of patients are not following the rules whenever they have SARS-CoV-2. There's still, I've seen that in my own practice, patients that I've diagnosed, and I still know they're going out into the public. It happens. Maybe they have to, maybe they don't have someone to go out and, go to the grocery store or whatever, but it happens. The second thing I would say is just because you're young does not mean that you will not have any issues from this virus. I think I've told you this story off the air. With the group that I train with, one of our physicians who was 40 years old, a college football player, darn near died from this, ran 7 miles a day. I think you would call him, if you saw him, the epitome of health, and he darn near died from this infection. He came within because of some of the things he did that we talk about all the time is why we believe he didn't end up on a vent. That's for a whole nother day. But that's the second reason. And then the third reason is post-COVID syndrome. Many people survive this illness and they actually don't even have that severe of a course, or at least they don't feel like they do. They feel like they have the flu, they feel achy, headache, myalgias, you've got the picture. And then, 5, 6, 7, 8, 9 days later, they're better. They think they're better. They start going out into the public. And then all of a sudden, a few weeks later, all of a sudden, fatigue, depression, memory loss, lack of ability to get their exercise tolerance back. These are things that people start to experience. And it's the dirty little secret of this illness, in my opinion. Not many news entities, not many physicians are very vocal about post-COVID syndrome, but it's real. And I think that we're going to be quite surprised at how many people suffer from post-COVID syndrome over the next year to 2 years. I kind of equate it to post-911, with all the first responders and then what happened to them months to years later from everything that they inhaled. I'm not trying to put those two situations as the same, but we don't always know what's going to happen a few years down the road. And then last but not least is the reason why a young, healthy person should get this is don't pass it around. It's overwhelming our hospital systems. Anybody that doesn't believe that is not looking at reality. I hear discussions every day from family members where their loved one is hospitalized in the ER for days because there's no bed available in the ICU or wherever they need to be in the hospital, because every hospital is overwhelmed by it. I had an ER nurse in my office just yesterday, and she said that one of her elderly patients was being admitted into the hospital, and the daughter said, and this was a standalone ER, so they don't have a hospital. And she said, well, make sure she gets transferred to a hospital where there is no COVID. And she said, man, there is no such thing. Every hospital in the world probably at this point is dealing with COVID. So that would be that's kind of a long-winded response, but that would be my response to why it's all of our duties to at least educate and consider taking the vaccine.
So what are some of the other treatments that are available now for if you do get it? What are some of the treatments that you know of that have been quite effective?
So we're treating quite a bit of outpatient COVID at the moment. Here at our ambulatory clinic, we have had in the county that I'm in, we've had a tremendous spike in COVID cases over the last 2 months. I don't think there's a business day that goes by that we're not treating another patient or two for COVID. And so a lot of the stuff has stayed the same. It's still very important to support vitamin D, vitamin C, and zinc levels, making sure you got those things going. Quercetin is a supplement that most of us are using now as well. It basically allows your body to absorb zinc. And then, of course, I love the ketone esters for COVID infections. That's a mainstay of my treatments. And then when we kind of start moving over to actual prescription medications, if allergies don't prevent it, I try to put all of my patients on azithromycin, which is an antibiotic. But of course, this is a virus. We're using it not for that characteristic, but we're using it for its anti-inflammatory / cell senescence capabilities. And probably the most recent thing that we've been, and of course, let me not forget Thymus Alpha 1, our immune modulating peptide that is part of a mainstay of a lot of our different treatments here at our office. But then, of course, we've started using ivermectin. And ivermectin, the Critical Care Society approved ivermectin as a first-line treatment for SARS-CoV-2, I want to say 3 to 4 weeks ago. They've actually made it part of their protocol. Now, one of the issues, like I've got a family that's, I've dealt with this a little bit on like guidelines. The problem with guidelines is every organization seems to have different protocols. And it's the one thing that's maddening is there's not, NIH has their guidelines, the Critical Care Society has theirs. It would really be nice if there was a way to actually everybody to come together and, create one guideline, but it's kind of the way our whole country is right now. It's hard to bring everybody together on any topic. But ivermectin is actually an antiparasitic medication. We use it in humans and livestock. Mainly in humans, it's used for like pinworm infections, that sort of thing. But it has a great anti-inflammatory characteristic to it. And the nice thing about the ivermectin is it's only, it can be used for prophylaxis if you've been exposed to COVID. It can be used for treatment of COVID. It can also be used if you're a high-risk individual, which I have a few of my like cancer patients or patients like that on actual prophylaxis weekly dosing to try to help lower their chance of contracting COVID. It's also very easy to dose. Providers can find online the protocols. It's just weight-based. It's tablet-based, so it's very easy to dose. And it's basically like if someone calls me and they have it, we dose it on day 1 and day 3. So it's just 2 doses and we're done with the ivermectin. We've seen a lot, since we've added ivermectin into our protocol about 3 weeks ago, we've seen some really good responses from it. I was a little bit, Fox News, I think, was the first news media entity that supported ivermectin, and it just flooded me with calls. And I was a little leery in the beginning, but after reading the literature and once the Critical Care Society approved it, been using it with really good success.
Critical Care Society, you are a specialist in working with the elderly.
Yes.
And so explain to us a little bit about why that's important.
Well, so it's really important. It's just, anything that we can do when our senior patients that can, because again, I go back to whether you're young or you're old, but of course, if you're older, this is a much bigger problem is this disease will turn on you and turn fast on you. I've seen patients that are doing just fine and 4 or 5 hours later, they're in respiratory distress. And we just don't typically see that with normal illnesses. Typically it's more like a few days, someone gets slowly worse, not completely fine 1 minute and 4 hours later, they're having to go to the hospital because they're in respiratory distress. And I think that's one of the most fascinating and maddening things about this disease is how quickly people can go from feeling well to feeling really poorly. That's the other reason why in all of my patients, although now it's hard to get a hold of them, I try to make sure all my patients, when they get this illness, have a pulse oximeter because your oxygen saturations are so important to monitor. And that's one of the big differentiating factors. In the beginning, it was like, well, if you're short of breath, go to the hospital. Well, hospital is going to turn you right back around if you get there and say you're short of breath, but your O2 sats are really good. Most likely they're shooting you right back out of there because they're so overwhelmed. So those pulse oxes come in really handy so that we can watch the O2 sats. And if they're staying still mid 90s, and even though they feel short of breath, that they're oxygenating properly, we can take care of them. One of the other treatments that's out there right now that in my area we simply can't get a hold of is the monoclonal antibody infusions. It's what President Trump got whenever he had COVID. I believe Ben Carson was another one of the famous politicians that got this infusion. And there's been a lot of frustration with families here locally because they want it for their loved ones. And I would love to give it to them too. It's just there aren't very many doses available, unfortunately, and it's very hard to come by.
That's the brand Regeneron, is that right?
Yes. So there's just not that, at least in our area, there just aren't that many doses of it. I've called multiple hospitals today trying to find a dose for a patient, and there's simply, no room at the inn at the moment. It's been all dry runs so far.
So the things that we can be doing, first of all, before we go there, the COVID attacks your lungs. It seems to be that's the main area that it overruns first, correct?
Not always, but that's where we see the most severe outcomes. We can actually GI. A lot of people now we didn't know that in the beginning, but a lot of people are having more like stomach flu type symptoms, nausea, vomiting, diarrhea, but they're breathing just fine. I tell my patients when I'm treating them on an outpatient basis, I'm just trying to keep your lungs going well. And like I had one of my patients, and she was in her 60s, and she was getting a little frustrated because she was on day 8 and she still felt fatigued and tired and achy. But I said, but the good news is you're breathing just fine. You don't have a cough. And, the side effects of this illness can last for different amount of days for different people. So what I worry about mainly is brain and lungs. Now, there's no way to know if a person's having some of the, memory side effects and things like that. I think the good news is if we treat this illness properly, most people will do just fine. The big issue that I have when I talk to patients who are healthy is, hey, here's how I recommend treating it. I'm kind of an all-in treatment with this illness. Some people choose to do it, some people don't. And like I tell them, I have no way of knowing how you're going to do. You could probably some people could do practically nothing and do just fine with this illness. Some others won't. And we don't have a good way of predicting how people will do. Because, one of the other things I hear now is blood type and all these different things. We don't really know if that has anything to do with it. I mean, that's all theory at the moment. Time's only going to tell when we look back at this illness in a few years and go, oh, that's why so-and-so did poorly with this illness, or that person did poorly. I mean, we know the obvious. If you're overweight, if you're diabetic, if you have respiratory problems, COPD and such, you have advanced age, you have a much more likely chance of having a worse round of corona. But we just don't, in the younger patients, we're just not sure always why that happens.
We're talking with Dr. Kris Wusterhausen of the Resurge Clinic, and this is our peptides and age management, and we're discussing today vaccines and various treatments. And so, Dr. Kris, what are some of the things that we can be doing to position ourselves to better be resistant or boost our immunity during this time?
So the easiest thing a person can do is what we harp on all the time, and that's nutrition and exercise. And as you've heard me say many times, and as you talked about your aunt at the beginning of it, I believe that even though we're not for sure why some people who appear healthy do poorly with COVID, I believe we can make some theories on that. And that is because just because a person looks healthy doesn't mean that their immune system is in proper function. And ultimately, if we eat better, if we mix in intermittent fasting, if that's something a person can do, 16 hours with no calorie intake, that's going to boost that immune system, improve brain function, improve athletic performance, improve metabolism. If we mix in that's the other thing I always tell my patients who get COVID is we want to, do a low carbohydrate diet. The virus likes glycemia, glucose is sugar. So if we can stay in a situation to where we're keeping low sugar intake, which is actually something I recommend to all of my patients, low glycemic diets, that's going to help not only prevent, but help treat the illness if we do get it. Proper sleep, I think we underestimate how important that is, just lowering our stress levels, getting a proper night's sleep. Circadian rhythm has so much to do with everything, and so many of us get poor sleep because of age, stress, improper sleep hygiene, bad sleeping conditions, whatever, a little bit of everything, improper hormone balance. We could go on all day about that. Those are different things that we can address. And then, of course, probably what I'm about to say, and that's thymosin alpha 1. I can't, and this is just me talking as I talk to my patients, as of today, so far, and now I don't know that this will hold up forever. I've yet to have a patient that has been taking their thymosin alpha 1 religiously that has had SARS-CoV-2.
And for those that maybe this is first time they've been listening, thymosin alpha 1 is
a peptide, which peptides are bonded proteins bonded amino acids, that many of them we have in our body. We have over 7,000 peptides in our body. Thymosin alpha 1 happens to be a peptide that we make in our thymus gland. And unfortunately, as we age, it starts to decrease, just like all of our hormones do as we age. It is in my opinion, the safest peptide that we have. And it is an injectable peptide, but it's an insulin needle. Most of my patients, you can do it daily, but most of my patients do it twice weekly and inject it subcutaneously. And it helps modulate the immune system. And as we've talked about, what does that mean? It doesn't mean we're making the immune system hyperactive. We don't want that. I always explain to my patients, it's like going out and buying the latest, fastest sports car. We want the ability when we hit the gas that it takes off and it's fast and it works. But we also, whenever we have our foot off the gas, we want it to, idle properly because you simply can't run the immune system at 8,000 RPMs all the time without it wearing itself out. So the term we like to use is immune modulation. Basically, when it sees something, it's going to pounce on it. It's going to take care of it. It's going to hopefully rid the body of it. And that is a very natural response. And all we're doing is boosting that natural innate immune system with thymosin alpha 1.
So thymosin alpha 1's signaling, what I like to describe is it's like sending an email to that part of the body that produces that particular peptide and asking it to squirt out some more right now because we'd like to have it. As you age, it starts to like hold the cards back a little bit because it doesn't know how long it's going to be in the game.
That, and I always say, we really weren't meant to live past about 50 years. We were meant to be born, grow up, reproduce, and die. And thank goodness we've come a little ways and we can do a little better than that now. But between our own natural biologic clock and then also the environment factors that we have added in, such as just stress, lack of sleep. I always think diet has a huge role in our hormones. The fact that when you and I grew up, we probably were raised on hormone ridden foods because that's just what was available. We didn't have organic hormone-free meats for the most part unless you raised it yourself. And I think all of these factors, and we never unplug in 2021, most of us at least. There's usually a cell phone at all times or something with us. I think all these factors together is why we see such a decrease in hormones and peptides when we start reaching our 40s and beyond.
What I like about these conversations is that every conversation ends back up at we're talking about how to improve, control, be proactive with our health, and everything starts at the cellular level. And one of the things about our cells is that they want to be in more of we tend with our diets and stuff to be more acidic.
Correct.
And so how can we start to maybe level up our pH and be a little more alkaline?
So one of these things I really struggle with, eating more green foods. If my wife is listening like now, I'm sure she could agree. I struggle with that aspect because it's just my palate doesn't always go for the green vegetables. But that's a great way to go about it. That's the first way. Food. Your meats and your proteins typically have a lot more acid to them. And so especially us guys, we tend to lean a little more heavily, most of us, towards the meats. And that's why, really, truly, for many reasons, mixing in the green vegetables is a good thing. And then, of course, our favorite, the Alka-Seltzer Gold, which is, and as I always make sure I emphasize it's the gold. You have to get it through Amazon. Although my local pharmacy, I've done enough of it, they now carry it on the shelves, which is nice. They were told me the other day they actually have stock their own surplus of it down there, because I put all of my and I forgot that one. Going back to COVID, Alka-Seltzer Gold. I use that as part of my protocol as well. So Alka-Seltzer Gold is basically baking soda in a tablet. It's not actually Alka-Seltzer as we know it, but it's the same tablets that you can break up, drop it in a bottle of water. If it's just for wellness, I recommend 2 tablets, which is what comes in a little package once a day. Basically, we want to induce as much of that basic environment as we can, because the bad stuff doesn't like base, it likes acid. And so if we can, especially intracellularly, if we can induce a little bit more of a basic environment, it's going to help us. And then if they actually do have an acute infection, acute viral infection, I like to have them do 2 tablets 2 to 3 times a day. And so that's how we use it in our office.
So on a maintenance level, would you take that on an empty stomach, maybe first thing in the morning?
You could. The nice thing about Alka-Seltzer Gold is if you have any stomach ailments, like, a little reflux or something like that, I mean, it really helps also with that. So empty stomach isn't a bad idea, especially if you have a little dyspepsia, a little upset stomach. Baking soda is a great, it's an old-fashioned remedy for that. That works. And so I typically do it with lunch. I just pop a couple tablets in my bottle of water at lunch, and while I eat whatever I'm eating, that's, when I do it personally.
So tell us about ketone esters. That's something that I didn't know about till you introduced me. And so I really like it. I get it at the website that's on the screen here, ketoneaid.com. But I really love how it's like, I take it in the morning on an empty stomach, and it's like your mind gets really clear. I just feel more dialed in and focused.
So the more I learn about ketone esters, the more I love them, and I'm in love with them. But as I've learned more and more about them, I've become more and more fascinated with them. And so basically, as we've talked about, it's the most efficient fuel you can give your cells to use. The analogy I use, and I'm a car guy, is if you have a race car and you're going to go down the drag strip, you're going to put racing fuel in it. You're not going to put, unleaded from the gas station. It just doesn't work that way. That's basically what we're doing for our cells. This is the racing fuel for our cells. But it does, that's a very simplistic way of looking at it. It actually creates a state of short-term ketosis. The average male dose creates a millimole of ketosis within the body. That's actually how we're treating COVID, because again, that ketosis is something the virus doesn't like. We like ketosis, as we talked about, in short bursts, but we don't like it around the clock for the most part, because of the side effects that you can incur with long-term ketosis. And what people notice whenever they do ketone esters is the improvement in focus. The brain fog typically goes away. There's no caffeine in it. So I always say, don't be confused. This isn't a caffeine boost you're getting. There's no caffeine in it whatsoever. It's pure ketone bodies. That's all that's in it. So improved athletic performance. An example I would give you, Maury, who we've had on our podcast before, we were doing wall balls the other day, 100 wall balls. And Maury's a beast, and he times everything he does. And so we did a little very unscientific experiment, but we had him, his best score he'd ever had. He went and he did 10 cc's of ketone esters, which is the normal male dose, waited 15 minutes and did his 100 wall balls, and he cut it by a minute and a half. He didn't just beat it by like a few seconds. He beat it by 90 seconds. And this is something he does like every 2 weeks. It's not like something he hadn't done in 6 months. So athletic performance typically really increases tremendously. I always use it before every workout. It just makes you feel better. It helps boost NADPH levels, which is basically the NAD version that's behind cellular redox, which we've talked about at times. It's just an amazing, amazing product. I just wish it was a little cheaper, but luckily we use it in small doses. I think the good news, as the word gets out and as more people use it. I know Frank at Ketone 8 is trying to get the price down as he can. I mean, as we've talked about, there was Bulletproof, Dave Osprey paid $20,000 for a canister of it just a few years back. So it's not nearly that expensive, everybody. Don't freak out. It's not that expensive. But if you do go there and buy it, if you put in the code Resurge, it will at least upgrade your shipping. I know that's not much, but that's the best we can do with the Ketone 8 at the moment.
That's excellent. So, all right, intermittent fasting, Alka-Seltzer Gold, some ketone esters. And then if you're a physician, could get you hooked up with some Thymus Alpha 1. What's another peptide that you would maybe complement that with?
So the other day I heard Dr. Seeds say this, and we're always talking about Dr. Seeds, that's who I train under, and I couldn't agree more with this statement. If you simply prescribe a peptide physician, okay, who I'm talking to with this statement. If you simply prescribed your patients thymosin alpha 1 along with a GHRH, GHRP peptides such as CJC, ipamorelin, you could improve 95% of your patients' conditions and lives. And that really kind of goes across the board. This isn't specific to one disease. It's just improving those growth hormone levels via the GHRH, GHRP combo peptides. CJC, ipamorelin being the most common version. You'd be amazed at how much you can help your patients. And as you and I've talked about, I train a lot of physicians with peptides, and I try to tell them, pick 3 peptides and just stick with that for 6 months. And the 3 that I choose are 3 to 4 is the first one is TA1, CJC, ipamorelin, and then thymosin beta 4. And now that we have BPC over the counter, it's a peptide, but I kind of call it a supplement. So I say those 3 plus BPC, and you can do so much good for patients with that simple, 4 peptides in different combinations without hurting them. That it's just amazing, in my opinion.
So the CJC, it's a signaler. It signals your growth hormone production.
So CJC is a growth hormone releasing hormone, GHRH, that signals the anterior pituitary in the brain to produce and release more growth hormone. Not to be confused with exogenous growth hormone injections, okay? I am not a huge fan, except in a few cases, older patients who simply do not produce growth hormone anymore. I'm not a huge fan of growth hormone injections. Quite expensive, very difficult to legally write, and if the person really didn't need it, you can actually put them in a situation where they have to take it, and then it also can cause insulin resistance. Now, that's growth hormone, exogenous growth hormone, okay? What we're talking about here are growth hormone secretagogues. We're causing the brain, its brainstem itself, the anterior pituitary, to produce more, release more, but by doing it this way, the body doesn't end up with super physiologic doses of growth hormone. It ends up with what I would call optimal natural doses of growth hormone.
So what does it do? So it tells you to grow?
Yeah. I always say it kind of teaches you not to grow. It actually helps. The big reason I talk to most of my patients is the fat burning potential that you experience with growth hormone, but it's much more than that. It causes us to sleep better. It does cause our muscle mass to go up if we're doing resistance training, but you're not going to go from a 150-pound guy to Arnold Schwarzenegger. These are not anabolic steroids. It's not what that does, but it will cause muscle mass to go up, body fat to go down. It causes decreased inflammation within the body. People sleep better. People do better. They're less stressed. They feel better. It works on cell senescence, which we've talked about many times. It's a cell senescence, anti-cell senescence peptide, as is thymosin alpha 1 as well. All these have different ways of kind of hitting that cell senescence aspect as we get older. So I like to call the GHRH, GHRPs the workhorse of peptides. It's kind of like if I only had to choose one, that's probably the one I would choose, just because it does a little bit of everything.
So the BPC, there's a lot of things that it does, but what's interesting, there's a connection between your gut in your brain. And it seems like BPC is like a great over-the-counter one that people could take that would improve that situation.
Yeah, BPC going over the counter has been huge, not only just because it gets it out into the hands of more patients. It's also brought the cost down, which has been a really good thing. BPC, I always say there's really 4 different indications that I use it in my practice, and that's repairing ligaments and tendons. People who have either acute or chronic ligament tendon issues, brain function or neurologic disorders. I get a call at least once a week from a physician saying, hey, I've got this person with this neurologic condition. I always have BPC in the protocol every single time. So Parkinson's, dementia, TBI, multiple sclerosis. I think those are all, we're not claiming that this is going to cure those conditions, but I think it will help their situation. And then GI, any type of irritable bowel, reflux, GI distress type stuff. And then last but not least, just overall wellness, again, cell senescence, wellness. It's actually, I heard a lecturer say the other day who uses it a lot. They were like, what about BPC? And he's like, oh yeah, I forgot about that. Everybody should be on that. That goes without being said, because the protocol that doctor was talking about, he forgot BPC. And he's like, well, no, that just goes without being said. Everybody gets BPC.
He's like, you're the only one that's not taking it?
Yeah, exactly.
So we're talking with Dr. Kris Wusterhausen of the Resurge Clinic, and our topic today has been vaccines and other treatments. And so what's one other thing maybe we want to wrap up with, Dr. Kris? By the way, we had a comment pop in. I don't know if you saw that, but yeah.
I did.
So your wife was listening, and she said maybe in 2021 will be the year that he adds more greens to his diet.
Yeah. Okay. Yeah. We'll see. I hope so. You know what? I don't know that I have a whole lot more to add other than I just want to really ask anyone that listens to this. First, I hope that they find it educational to answer some of the questions that they maybe have with the vaccine. I think that this is just a time to open your minds and actually listen to the real scientific data. I actually saw a funny TikTok video from a physician a few days ago that, was hilarious. And he's like, I'm so tired of everybody's opinion counting the same. And your third removed cousin says it's going to make you grow a chicken wing or something. And all I'm telling my patients is I don't mind if they say I'm not going to take the vaccine. Just please be educated. Don't get led down paths that there's government chips in them, that they're going to track us. That was one thing I've heard a lot of. Come on, guys, it's a multi-dose vial. How are they going to draw up the chips whenever you got 10 shots in a bottle, plus it won't go through the needle? It's ridiculous. Just be educated. If you are open to it, be patient. It's not going to roll out as fast as we want it. Stay safe until you do get the vaccine. I know we all want to just go back to normal. Every one of us out there wants everything back to normal. So do I. We're close. I promise. We're way closer than we were back in March. We just got to hang in there just a little bit longer. And then side effects of the shot, most people, maybe a little bit of myalgias, headache, low grade temperature, just aches and pains. The second one, they say, does have a little bit higher chance of having a little bit more severe symptoms. There's been 3 or 4 cases of anaphylactic reaction with this shot, but Steve, that happens with the flu shot every day. Despite what's said on Facebook, no one has died from this vaccine. That's some rumors that I've seen floating around on Facebook. No one in America has died from being given this vaccine. That's not true. I think that would just be my departing words on this vaccine.
All right. Dr. Kris, it's been an excellent conversation. I've enjoyed it very much. If you're listening and you enjoy this, let us know. Be sure to like, share, tell your friends and neighbors. And also, if you have a question that you would like us to discuss, like to hear Dr. Kris tell us a little bit, help us get a little more insight, be sure to send that in. You can connect with Dr. Kris at theresurgeclinic.com. And I guess we'll see you next week at the same bat time.
Thanks, Steve.
Thank you, Dr. Kris. And that's a wrap.